So Deborah, Jennifer, and Byron want to know your thoughts about the County Board of Supervisors' decision to move forward with reopening our county in spite of our county health and human services and Governor Newsom's guidelines.
Yeah, it came as a surprise as much to me as it did all of you. I certainly I wasn't consulted. The hospitals I don't think were necessarily involved in that decision. I don't think it was on the agenda, so it kind of came out of left field. I do know that the county very much, all of us, I think, were very disappointed when the governor came out with his revised Phase 2 guidelines and said that of the 58 counties in California, all but 5 qualified to move into Phase 2. Tulare County being one of the 5, Kings County being one of the 5 that were not permitted to move into Phase 2. And I think that angered a lot of people, frustrated a lot of people, because the reason that we're in that 5 is almost entirely due to the breakouts in the nursing homes, which are very contained facilities. It's not a reflection of just widespread community spread of the virus. And to simply have the governor just look at the numbers, look at the percentages, and ignore, the composition of that, I think really frustrated the county. And I know, this county is suffering. This community is suffering. There's so many people that are out of work, that businesses are closed. At Kaweah Delta, we're a business as well. And when you have to turn away 40% of your surgery customers, and you have to lay off staff and cut their hours, and we're like every other business in the community, we are allowed to stay open, to take care of emergent healthcare needs. But I really, I sympathize, I empathize with all those businesses and towns that have been just, devastated by this. So I understand the pressure that the county was under. So I kind of expected, I actually, earlier today, as part of one of the ways that a county can open up is if the public health officer attests that all of the conditions are present that would allow us to open up. And that means the hospital has to have surge capacity, which we do. The hospital has to have adequate personal protective equipment to be able to support a surge and all the demands that would have. So I prepared and sent a letter to the Board of Supervisors supporting Dr. Hott's attestation that we as a hospital were prepared to support a resurgence if the county opened up under Phase 2. I was surprised that the county, if I understand it right, its action was to move straight to Phase 3 and to skip over Phase 2. So I don't know, I don't have all the different phases memorized, but there's no doubt about it that it opens up more and more and more, allows more and more businesses, salons, restaurants, bars, things of that nature to open. Although the second phase of Phase 2 allows some of that to happen as well. But Phase 3, actually, I don't think the governor, what I was just reading, I don't think the governor has clearly defined the criteria for Phase 3 yet, and how that is so different than Phase 2. So I'm not going to criticize or judge the Board of Supervisors.